It may seem strange that we have to think about safety at all in relation to healthcare, because surely it's the very definition of being looked after, and being safe is to be in hospital or be looked after by your doctor or nurse. But there are various reasons for this. One is that because healthcare has been successful, we have many powerful drugs and powerful treatments, but of course all of these carry risks. But the risks are not only from the treatments, but from the healthcare system, because you can get given the wrong drug or the wrong treatment or the wrong dose, or lots of things. There's different ways things can go wrong. The other reason is that people are now living longer, so they have more complicated medical histories. So that allows more opportunities for problems between different treatments. And the healthcare system is very complicated. So something very complicated means more opportunity for failures. So these are all the reasons, and this is the nature of the problem of safety, and this is what we're trying to do something about. Now, doctors and nurses and all healthcare professions have always be concerned about safety. And part of safety is, of course, individual responsibility, being careful, being cautious. But we know now very well that that is important, in fact it's essential, but it's not enough. And you have to think much more about the wider system of healthcare, just as aviation or the nuclear industry think about the whole way the system operates when they think about safety. So sometimes you can make things safer by automating things. So we've got a wonderful system of barcoding in Oxford region for blood transfusion, which is much more reliable than human beings. And sometimes it's about different types of teamwork. Read back, where you communicate very clearly and you say back to make sure you got the message right, no miscommunication in the operating theatre or between doctor and patient. Or because teams can work much more effectively by having systems of monitoring each other to make sure they've understood, or picking up errors or picking up little problems that occur. So there are many, many things we can do to make the healthcare system safer, as well as relying on individual professionalism of doctors. Now, of course, all this is happening in the Oxford region anyway. All the organisations in the region are already working on many of these topics. NHS England has launched 15 patient safety collaboratives, one of which is in the Oxford Academic Health Science Network, to support the existing safety work in the region. So we are going to have a central group, a central team working on safety, in touch with all the organisations in the region. We're going to run some specific programs on the measurement of safety, on leadership, and we're going to have some clinical topics to begin with: pressure ulcers, acute kidney injury, restraint in mental health, and medicine safety. And we're going to bring people together on the basis that collectively we can act more effectively on safety than we can organisation by organisation. That's the basic idea of the collaborative, and that's what we'll be working to do. The other very important thing that we'll be doing is to work with patients and carers of people who are receiving healthcare, and particularly healthcare in the home. As patients, we can contribute to some extent to our own safety in hospital. We can be careful about not falling, about following the instructions we're given, and we can speak up if we feel that someone hasn't washed their hands, or, you sure that's the right drug for me? That's important. But in the home, it's even more important, because people are now having very powerful medications in the home. Sometimes injections are being given. And in the home setting, patients and carers are the people in charge of home care. So they have the potential to make errors and to cause safety problems as well in their own care. So I think a very important part of our work will be to listen to patients, listen to people looking after them, to understand their safety concerns and to bring them as part of the wider team working on safety. And that's the spirit in which the collaborative will operate, this working together to improve the safety of healthcare in our area.